Hey guys, good morning. We're going to talk about the spinal cord today. All right. So, based on everything that we've talked about, right, if you had to guess which sense is most represented in your spinal cord, what would you say it is? Movement, right? And if you didn't say movement, okay, we'll talk about that later. So, more than 50% of all the neurons in the spinal cord relay proprioception. And when I read that, that seemed like kind of an extreme number. So, of course, I had to start doing some digging, right? So, check this out. This is your spinal cord, okay? And everything that you see right here in that purple circle, that entire posterior part of your spinal cord, though that entire chunk carries proprioceptive information from your feet, from your trunk, from your spine, from your hands, your arms, your limbs, every bit of it. That is solely what that entire like V-shaped area of your spinal cord does. All right, that blue area there that's circled. So, and just so you guys kind of look at this anatomically, right? So, you're looking at this from front to back, right? So that kind of crease, that indent that you see, that's the front, right? And where that purple circle is, that's the back, okay? Now, look at, so first, when you look at this, all of the blue areas are sensory fibers, okay? And all of the red areas are motor, okay? Which means that everything that's blue is going up towards the brain and everything that's red is coming down from the brain to create an action, all right? Now, the next area I want you to look at are these areas of blue on the sides, okay? This is what's called your spinocerebellar tract, okay? And then if you look kind of just down below it, there's another little oval there that's called the spino-olivary tract. Those are even more proprioceptive fibers, all right? Those go, where does it say? From your spine to your cerebellum, right? That's exactly what they do. Your spino-olivary fibers, it's the exact same thing. The olive is a part that sits right next to your cerebellum. The last thing I want you to look at are these red areas in the front, all right? It's called your vestibulospinal tract, all right? If someone has a disc injury, which we see pretty commonly, this is the very first area that tends to get clipped by a bulging disc that bulges back towards the spinal cord. All right. What does your vestibulospinal tract do? It relays posture, right? It is the postural control for your body. Your vestibular system largely governs that. Okay, and these are the wires that come directly from your vestibular system down to your spinal musculature and governs your posture. So if someone has an acute disc injury, right, or any sort of significant injury that creates interruption to the front of their spinal cord, their posture is the very first thing that it hits. Not a pain fiber, all right? Pain fibers are back here. They kind of look like a little piece of salmon back here, where it says cervical, thoracic, lumbar. They're blue. All right, that's the pain center. That's not even close to where a disc even hits the actual spinal cord. Now there are other places that it can hit, but I want you guys to see this because, believe it or not, most chiropractors cannot even draw this. Right? Forget the colors and the slices and all that sort of stuff. Most people cannot even draw a picture of the spinal cord. Your family doctor certainly cannot draw a picture of the spinal cord, right? This is what makes us different of bringing this level of education, not just to you guys, but of course always to our patients, right? That's what gives them the confidence to refer their friends, their family, all that sort of thing. Everything we've talked about changing a life, sharing the care, all that sort of stuff. It starts with us exuding the confidence and bestowing that confidence onto our patients to have the confidence to talk about this with their family, with their friends, and of course, for them to trust us enough with them. So contemplate that and have a great Thursday.